Hello and welcome to COVID-19 Local Impact on Your TV. I'm Dan Malta from the Your TV studios in Peterborough. We'll get today's show started with a quick glance at the COVID-19 statistics from the region, starting off in Peterborough City and County and Hiawatha and Curve Lake First Nations. 78 current confirmed positive cases with more than 6,900 individuals tested. 2 deaths. 69 of the 78 positive cases have been resolved. As you'll see there in that number, 7 active cases. 1 current local institutional outbreak in the city of Kawartha Lakes. 145 confirmed cases, 2 probable cases, 29 high-risk contacts, 9 hospitalizations, 118 out of 145 cases have been resolved, 32 confirmed deaths as part of 3 confirmed outbreaks, and in Northumberland County, 16 confirmed cases, 2 probable cases, 15 out of the 16 cases have been resolved. With the heightened adherence to cleaning surfaces, whether it be in your home or out in public, people are more aware of the coronavirus potentially being on surfaces. Peterborough-based company Optosolve is seeing an increase in business due to the pandemic. Your TV's Mary Tendichet speaks with the co-founder of Optosolve Technology, Natalie Ambler, who says they're able to make the invisible germ visible.
Optosolve Pathfinder is a technology that detects organic contamination on hard, non-porous surfaces. We're now able to provide images of potential risk in the environment.
Many organizations are already using Optosolve to detect germ contamination.
We work with organizations like hospitals, long-term care would be some of our healthcare connections. We also, prior to COVID-19, worked a lot in food safety. So that would be a food processing plant. With the emergence of COVID-19, we're seeing a lot more commercial and institutional spaces also be interested in the technology, such as schools, post-secondary education facilities, recreation facilities, and office spaces as well.
Ambler says using their software, they can track data on how clean surfaces are.
This allows some measurements and metrics so that we can do continuous improvement and look at improving outcomes. We also have surface imaging technology, which is our unique proprietary technology. This is the visualization of surface contamination in the environment. When you look at the images, they're intensity maps, and you're going to see the contamination on those surfaces ranging through a color spectrum. The yellow would be a less intense contamination on that surface. Orange is going to be high, and then the red on that image is going to be severe contamination on the surface.
Ambler says they are launching a mobile upgrade to their technology, which will provide instant results.
So what this now allows us to do is be on site and give real-time feedback of that contamination on surfaces.
Common surfaces for contamination are door handles, light switches, and IV poles or call buttons in a healthcare facility.
But it's not always the ones that you would think as the most germiest that end up being the most germiest. So, often we'll find that a lot of attention has been paid to a washroom facility for cleaning and disinfection. And sometimes it can be more of those, what we call gray area items, where the responsibility for cleaning and disinfection isn't as clear. In an office space, for example, that might be a computer keyboard or a mouse. As people begin to integrate back into their normal day activities, buildings, offices that are wanting to keep their workers safe, we're also seeing interest from hospitality as well as people get moving back out into their normal travel plans. And then, very similar to what we saw after SARS or MRSA, I also think that the healthcare is going to reflect back and really pose that question of what can we do better next time? People are going to be asking those questions. How do I know this space is clean? How do I know this space is safe? And we feel like our solutions can help provide some assurance to those questions.
Ontario Premier Doug Ford announces the province has put forth $20 million in funding for research projects in Ontario focusing on COVID-19. He states he wants Ontario to be the leader in developing a vaccine.
The key to beating this virus once and for all, the key to getting things back to normal, is finding a vaccine, finding a cure. Because until we find that vaccine, the fight isn't over. And that's why over a month ago, we made a strategic investment. We put $20 million towards Ontario-based COVID-19 research projects. We armed our best and brightest with the funding and the tools they need. And we made that investment because I believe in the people of this province. Ontario, as I've always said, has the best and brightest in the entire world. We're a place for big ideas, and we can achieve whatever we put our mind towards. From insulin to stem cells to open heart surgery to HIV prevention, Ontario has pioneered life-saving vaccines and treatments. And our incredible scientific, research, and post-secondary community has stepped up in a big way. They've put up their hands. We've received proposals from every corner of this province. And today, I'm proud to announce that we're moving forward with 15 of the most promising proposals as part of the first phase. Proposals like a new rapid testing method put forward by St. Joseph's in Hamilton that would enable 6,000 tests per lab a day. A McMaster study of recovered COVID patients if antibodies remain and continue to fight the virus. A food security project by Western University to study how food retail businesses are impacted by adapting to COVID-19. And a University of Guelph proposal to advance a vaccine. My friends, any of these are groundbreaking projects. They have the potential to be a game changer, not just for Ontario, but for Canada and the entire world. And I want that vaccine to be discovered right here in Ontario. I want us to be the global leaders in this fight, and I know we will be. Ontario is leading the country in clinical trials for COVID-19 treatments and vaccines. We have over 20 trials happening right now. 11 of those have already been approved by Health Canada. Our world-class hospitals, universities, colleges, and brightest innovators are working together and leading the charge. My friends, there's nothing Team Ontario can't do, and we will get through this together. Thank you, and God bless the people of Ontario.
Prime Minister Justin Trudeau discusses a potential second wave of COVID-19 at his press briefing today.
One of the things we know is that in pandemics there are usually second waves. The question that we're very much focused on is, as that second wave begins, or as we start to see resurgences in a reopened economy, how quickly are we able to contain them and control them? And that comes down to the scale of testing, the scale of contact tracing we're able to have right across the country. That's why the federal government has stepped up in its offer to provinces to support them in massively scaling up testing capacity and contact tracing capacity. We know, particularly in those areas that are still working to get the spread of the virus under control, it is going to be important to increase testing now, as we're seeing in those areas, but also make sure that as we move forward through the summer and obviously into the fall, we are ready to act extremely quickly so that the population at large won't be in situations of having to go back into confinement. But that depends on citizens doing their part. It also depends on having that testing capacity, and that's what we're moving forward on. We have already seen significant ramp-ups of testing in places like Ontario and Quebec, where there is a need for even greater testing. Last week with the premiers, I laid out that offer that the federal government could take it on, and we got positive responses from right across the country. We're going to continue discussing that tonight and talk precisely about how we can scale up testing immediately in places where it's necessary, like in Ontario and Quebec, and be ready to scale up almost instantly in places where right now the virus is pretty well under control, but any flare-ups need to be responded to extremely quickly. That is the frame that we're laying out. We don't want logistical or financial limitations to keep anywhere in this country held back from doing all the testing that is necessary. That's what the federal government will be there for.
As COVID-19 local impact continues on your TV, an update from Northumberland County. Hello and welcome back to COVID-19 Local Impact on your TV. I'm Dan Malta. The Ontario Legislature began sitting in Queen's Park once again this week. Northumberland Peterborough South MPP David Piccini tells your TV's Mark Rockburn he praises the work all his colleagues from all parties are doing to help the residents of the province.
It's been clear the Premier from day one has been very straight with Ontarians and been very forthright in both the things that we need as a community and what he is hearing from Ontarians. And part of that is a real acknowledgement that we have to work together. We're a Team Ontario, and that Team Ontario includes all members of the legislature. We've been working productively with NDP, with the independent members, and I've been in conversations with NDP colleagues of mine who've been very, very productive. Our critic in colleges and universities has come forward with good ideas. A good friend of mine, NDP member out of Kingston, we've been talking about abattoirs and our processing abilities as a province. So I think that in all of this, if there's a silver lining, it's been that a real productive and working collaborative relationship. And I think when Ontarians look at that, they've seen real leadership in Ontario, and we should be proud. And by that I mean leadership in the entire legislature. I don't know if we've seen that really throughout the country, or certainly when you look down south of the border. But when you look to Ontario, it's a collaborative working environment. We're holding question period where the opposition is holding us to account, and I think that's important that we are enabling. And we were doing this long before they were doing it at a federal level. It is allowing the opposition the ability to question government, to hold us to account, to work together, to make advice. And as a result, you saw the opposition vote in favor of our action plan. And I mean, find me a time in Ontario's history where the NDP has supported a conservative budget. I think it's, I think that speaks to the collaborative spirit in Ontario right now, and one that we need if we're to get through this together.
Obviously, questions are always arising about social distancing. How's that working within the legislature?
That's a great question. So we now, traditionally, you'd have to be in your seat to both vote and to pose a question. And it's been interesting because, whereas before you'd run to your seat if there was a vote count and the clock was winding down, it's a little mad dash to dive in your seat to get there in time, or if you're speaking and in the legislature, to be recognized, you have to be in your official seat. So that's all changed. I think a student of history, I don't really recall a period of time before where you could speak outside of that. So you can speak anywhere in the legislature. We're staggered apart, both vertically, horizontally staggered. We have a limited number of people in the legislature. We have some people on standby, obviously, as well. And we take turns going in as a team.
Another project affected by COVID-19 was the Port Hope Area Initiative. On March 18th, CNL suspended all PHAI work in Port Hope. Mayor Bob Sanderson gave Municipal Matters host York Bell Smith an update on where the project currently stands.
They decided that they would shut down for a period of time, and they're now in the process of getting ramped up to reopen. And they are, because it's CNL, it's not just Port Hope, they have other sites as well. So they've put a lot of time and energy into making sure that they can start up properly. The first thing will be to reopen the repository areas so that they can deposit material. The next thing is to look at the sites that they can handle as quickly as possible, as safely as possible. So they're probably going to be the larger sites. The smaller sites will probably have to wait a little bit. And I haven't had this conversation with them, but all businesses, including construction businesses, they're putting 2 or 3 times the resources into getting the same job done because they have to have distancing. People have to be in different trucks, etc. So that is slowly, and I commend them for taking that initiative. They felt they should do that. They didn't need to, by the way. The government didn't shut them down. They voluntarily did that. Now they're also ramping back up to reopen, but they're going to do it slowly. They're not going to rush it. But we're in fairly constant contact and being updated. From that perspective, the project's going to proceed. It might be longer timelines, but that's been something that the community's been dealing with over a period of time. But what I do like it is that they're looking after their staff very well. They're looking after the entire community in many respects. The other part of it is they aren't sitting and twiddling their thumbs. They're continuing with all their research and what they need to do for assessments and what have you. So they're doing a lot of work on engineering, designing, and all that kind of stuff. You may not see the trucks rolling around, but there's a lot going on behind the scenes.
Well, this actually, when you talk about it that way, is a great opportunity to get all of that planning stuff done. Things work out better when you got a solid plan. If you could focus on that, especially at the stage where we've gotten to now, I'm sure they've run into some things or can foresee some things that they need to address. They can take care of all that now, and then when they do get back up and running, whatever that's going to look like, they'll be off to a better start.
But that's an excellent point, and that's one that's being brought up because they had reached a point in the project where it's fairly extensive and in small sites, and they were running into some challenges. And to try to correct the challenges in midstream while you're working on it all is a little bit harder. So they have definitely been taking those lessons and challenges and looking for solutions. And I can validate that for sure because we have that dialogue with them on a regular basis. Our municipal team, led by Sue Bernardi, is in constant discussions as our peer review is. So we're looking at the solutions they're bringing forward, and we're having time to look at them without the mad rush too. It unfortunately does affect people who would normally be working who may not be, contractors, subcontractors, and we're giving some attention to that to see how we can make sure that those who are in our community aren't suffering too badly as a result of this shutdown.
Well, that's the residual effects of all of these shutdowns. How it spreads out really drastically.
It is like a house of cards. I mean, the construction business is a prime example. Now you can get back into some construction, but it reverberated all down the line to suppliers and contractors and subcontractors. You don't kind of really realize it until you stop one thing, and the whole thing has to stop. And then the whole thing has to start again. That can take a bit of time.
As more organizations are forced to cancel major fundraisers, the CCRC has modified its 15-year-old Jukebox Mania event. Normally, the event is held in the Memorial Center with 500 people in attendance. This year's Jukebox Mania Connections will now air on Your TV and online Friday, May 29th, and will feature local musicians and community partners.
Our big fundraiser is Jukebox Mania, which draws in between the participants and the volunteers and the food vendors and everybody who participates. It's usually around 500 people who come to the MEM Center. It's our big fundraiser. That's what generates our fundraising income, most of it for the year, and we had to cancel it, obviously, as most other charities did. We're all kind of in the same situation with, we rely on events to get the word out about our services, to reach people who we maybe haven't reached before, to get our message out that we have these services available, and to generate some income. And that didn't happen. So We have a great committee that's made up of some staff members and volunteers within the community and our board members, and they've been sitting at a table for the last couple of months, a virtual table, trying to figure out what to do. How do we respect some of the businesses who gave us donations for our silent auction that we have in hand, that we aren't having a silent auction at Jukebox. So what do we do with those things? How do we respect those small businesses? Because that's part of what Jukebox is. It's to showcase the great community support that we have from local businesses and from local people. And we had sponsors. We had businesses who were helping us pay offset costs and sponsoring, and that was part of our revenue. And then we, of course, had our participants we have some who've been coming right from the get-go. This would have been our 15th year of hosting Jukebox. So we've been trying to figure out, like, what do we do? And we had come up with the sort of broadcast thing, trying to find some local musicians who are willing to donate their time and their talent, and also kick off an online auction where we can showcase and we can try and generate some income. So we can showcase items from local businesses who have given us permission to use it in this way, use their items, whatever they've donated, and to also recognize the sponsors who stuck with us. We had some sponsors who said, yeah, we recognize the value and the service that you're doing for the community, and we really want to support that. So it's also a way to have a little bit of entertainment as well. You can watch it on Kojiko, on Your TV. You can watch it we'll have a link to the Your TV broadcast on our Facebook page and also on our website.
Robert Skuzlin from Your TV Windsor was able to catch up with Blue Jays Central analyst Joe Siddle. They discussed the current situation, how they're maintaining an audience in these times, and the potential of having a baseball season this year.
One thing we have done, and we weren't sure how this was going to go, we got sent home right around the middle of March when Major League Spring Trainings shut down. And when we came home, we were literally just told to kind of sit tight and we're going to see how this goes. Well, after a couple of weeks, the decision was made that Jamie Campbell and I are still doing our Blue Jays Central show, but we're doing it virtually online. And we've produced a show a week that is not going on to television just yet because there's nobody, I don't believe, in the Rogers studios in Toronto. So we're doing it online. They're posting it on sportsnet.ca. I think we've done 3 or 4 shows now, and the plan is to continue with that. And at least the last couple have gotten a little bit more interesting for us because we got to talk some baseball, because the baseball talks are increasing, not so much about the pandemic, but where baseball may go in these next couple of months, because the discussions are happening more and more, and they're getting a little bit more pertinent to baseball being played back on the field. And so fingers are crossed for all of us.
What are your thoughts on the Major League Baseball proposal to start the season up?
I find it very hard to believe that baseball can be played, yet I understand that we all want and need for it to be played. Let's not hide anything here. Money's at stake. There is no question. It's a $10 billion industry now, so I think both sides will do everything they can to get baseball played on the field. The first proposal we heard the other day from the owners to the players was all about the strict rules and limitations and distancing and where players can be and how they have to share meals, and the list went on and on, pages and pages of it. When I saw that, I didn't even parse through the whole thing. I just kind of looked and thought, wow, how are you ever going to keep all of these things in check? So I'm sure things will have to be rearranged a little bit as they go, but they're following the direction of the health officials, which of course is the right thing. But it sure seems like it would be very difficult to implement all of these changes that they're asking for. Now, this is just the first step. Hopefully that first step is going to be the first step to a lot of quality following steps that lead to baseball, because we know that the owners and the players have butted heads on a lot of issues, mostly financially, over a number of years. And the financial proposal has not even come out yet from the owners, but the last I heard was that the owners aren't going to expand on that until the players will receive somewhat of a cut, which they have in terms of prorated salaries. But then the players say, we're not going to reply to any financials until you open your books. Well, it feels like we're back to collective bargaining. And that's not a good thing at this time in the world. So hopefully these two sides over the next couple of weeks can get together in some way, shape, or form and not have finances prevent baseball from returning.
Yeah, and we don't even get into all the ticket takers and the restaurants from around there, the parking, concessions. It's just an unfortunate situation because if they were to come back, there's no fans to, support those people.
Yeah, I think if baseball comes back, there will definitely not be fans, at least to start. And you're right. When you mention all of those people, because I go to the ballpark every day at Rogers Center with our job. When the Blue Jays are at home, we do our show from a set at the stadium. And there are so many of those people that you run into. The ushers, I'll be going from our set down the left field line down to the clubhouse before batting practice. I run into 3 or 4 people every day that you stop, have a little chit chat, because it's the one guy that's taking tickets. It's the one woman that's getting the souvenirs ready. And it's always a quick hello. But those are the people you really feel for, because it's hard enough for the fans to feel sorry for the millionaire and billionaire owners and players. Unfortunately, that's just the narrative, and it is the truth. But hopefully for all those other people, too, this game can come back, let alone the fans.
Yeah. Spring brings us a renewal, and kids are looking forward to starting the ball season. What do you advise young players to do during this pandemic?
Well, social media has been a wonderful thing, and I see all kinds of kids, whether they're doing their tee work or soft toss out in the driveway or hitting wiffle balls. Whatever you can do, that's what you do, because you have to try to stay sharp. I remember even back in my playing days and when I was coming up in the minor leagues, spending my winters here in Windsor, I used to drape a blanket over a piece of wood or a cord in my garage and just fire balls into it to simulate that I was long tossing. So you're trying to continue to increase that workload, just as though you were in Florida outside throwing and getting your arm in shape for spring training. Same you can do with hitting. And I said wiffle balls are a wonderful thing, but there's nothing like the real thing. And right now, that's the case for everyone. You just can't get together and do those things. Hopefully things improve in the near future, but you do everything you can. And I see a lot of kids getting creative, and it's a wonderful thing, whether it's flipping to each other in the garage or on the road, whatever they can. What I've seen for the most part, they're doing it safely. They're social distancing and keeping their distance. Hopefully they can get a little closer soon.
That's the show for today. For Your TV, I'm Dan Malta, and we'll see you tomorrow.